Each of you are eminently qualified to speak on this subject. And we're especially pleased that the discussion is being led by an equally qualified moderator, Richard Eisenberg, who is a nationally syndicated journalist and author. Richard, you may know, unretired himself from his job as managing editor of the PBS website for people over 50, Next Avenue, where he was also editor of the site's Money and Policy and Work and Purpose channels, and a frequent writer. Since unretiring, he's been writing the View from Unretirement column for MarketWatch and articles for Next Avenue. To top it off, he was our 2022 Impact Awardee. That said, let me turn the time over to Richard, who I'm looking for there, and invite the honorees to come up and take your seats. Enjoy. Okay.
Thank you so much. Everybody settled? Great. Well, thank you, Remus and Andy, for having this panel. I think it's going to be a lot of fun. We're going to do it in 4 themes: aging, health and caregiving, retirement and money, and intergenerational relationships. 4 really important topics, I think. But even though our lives are long, our time is short, so we're going to get to it right away. First question I've got is going to be about aging, and I'm going to open each question to all panelists, but don't feel compelled to talk. So the first question is, and let me start with Lorraine on this. From your experience, what are some common challenges that older adults face in New York City or other urban settings?
Besides the notion of aging and ageism, which we'll talk about probably more in detail later, I think there's the issue of accessibility and information. I think it's one of the biggest challenges. We have a myriad of services and an entire network, many of who are in this room and strong allies who provide services that older adults in New York are not aware of those. So it's a whole public education, and access to those services. And then there is the physical access. Even though you would think of New York City as this major transportation hub, that exists only if you live in Manhattan. And that doesn't exist if you live elsewhere. So we have all of these challenges in terms of mobility for older adults. And that's one of the other things. The other thing is about affordability. And affordability is a very personal thing. What services can you afford? What services can your family afford? How much of your resources? How is that going to change your lifestyle? So it's that entire conversation about finances, accessibility to services, and managing those services both physically and through information and navigating through them. Some of them are very, very complex. Those are the common themes, and I think it's true for no matter where you are aging, but I think it's particularly true for larger cities.
Thank you. Rosanne, any other challenges or anything you want to add?
Yeah, I agree with everything you said, and I particularly want to figure out some way that people can easily figure out what is there and accessible for them. But I also think that we probably have more medical care in New York City than some countries have, okay? And yet, finding a primary care physician in this city is almost impossible, okay? And I continually get people coming to me asking for a quarterback, somebody who will help coordinate all these tons of specialists and help them understand what's going on and what do they really need and what is just checking off a box. So my answer to you would be, we need to reform the medical system. Simple answer.
Only 20 minutes, I can do it. Any other comments?
come through.
So I actually want to piggyback on that and add that we also have a problem with getting neurologists to see patients. Obviously, with anybody who's experiencing memory loss, oftentimes it is driven by a crisis, and they're oftentimes a 14 to 18 month wait, which is, so I'm with you that there needs to be complete medical reform. And then I think in the space of people are embarrassed if there is a memory impairment, whether themselves or in their family. And so really being able to find a trusted partner, like an organization like CaringKind, to be able to feel comfortable and being able to describe and get some of these care plan pieces in place, because raising concern and awareness about this is a huge battle.
So we've heard much about ageism tonight, rightly so. I wonder if you can talk about how ageism is being addressed today compared to in the past. Rosanne, do you want to start on that?
Well, I think it's out of the closet compared to where it was in the past. I think people are talking about it. I think we have a lot of people who are experiencing it, and surprisingly, okay, and these are celebrities that are kind of, this is happening to me. And so the word is starting to get out there. I think the other thing that's happening is this whole concept of intersectionality. And so we're really beginning to understand how age and being a woman, or age and being Black, really has an impact above either of those alone. So I think that's really important. I want to mention one of the things that we're doing is with our third-year medical students, we do a section on ageism for every third-year medical student at Mount Sinai. And it's a series of things. It starts with a discussion, and then myself and Dr. Henriksen are the old folks. And we give them some information on what we know about aging and aging people and how they should treat older people when they have them as their patients, okay? And what mistakes they might make because they're not thinking about what might be different if you're 80 versus 50. And it's been an incredibly open discussion that has come from that. And one of your former grantees, Ashton Appleworth, right, we use her TED Talk to start the whole discussion off, and it's like the eyes open up. And then through their whole rotation, they write in this little Padlet or whatever it's called, what they are noticing that is ageism in the care that they're being exposed to. And I feel like it's the start of something to open their eyes, to understand who we are as older people.
What do you think surprises the young students the most about aging and ageism when you talk to them? What do you think?
I think what surprises them is how many of us are so good and are able to do so much. And I think the other thing that surprises them is what matters to us, what makes a difference. And that, again, all of these things that they're being taught may not apply when you get older, because you're not going to live long enough, because it's going to interfere with you being able to have that engaged and meaningful life.
And I think one of the other pieces that I want to add to that, everything that you said, I totally agree. I think young people also are surprised that it is so ingrained, that they learn it so early on, and it's so ingrained, and that it's just like any other ism. You know, it's information that's been ingrained, and you have to learn how to unpack it. So I think that that's one. And there's AARP has this wonderful approach. What they do is they recognize people who combat ageism. They have movies for grown-ups. They have ways that they celebrate artists and people who are being celebrated and seen in a totally different light. So they give ageism a different spin. They give a positive. And I just want to say that at New York City now, we have a cabinet for older adults. And what we've done is to make sure that every city agency, at least the 24 that are part of this cabinet, their staff is trained on ageism. We're doing it for the frontline staff at H&H, which is our hospital system, and we're doing it for the Department of Health. And the one that we're the most proud of is that we're doing it in schools with middle school and high school students. It's really looking at ageism early on. I wish we could take credit for that notion of teaching it in schools. That came from young people themselves who were interns at New York City Aging, and they said to us, we didn't know any of this, we've never learned this, and so then we have a partnership out of the school systems. So that there are ways that we're all surprised by it. But then we think, what, it took 100 years for women to vote. 100 years of pushing. So we've been at this for a little bit, we've got a way to go, but if we don't start and we don't persist, we'll never get to the finish line. And we know that when you get to the finish line, sometimes you gotta go back to the beginning. We've seen that in women's rights.
Richard, I just wanted to add, I think the social media has done a really good job with aging well and promoting, I think, aging in a positive light. And also, you know, in respect of what we do, in talking about brain health and prevention on aging well and taking care of yourself. And I think, you know, I'm actually a dermatologist by education and went into this, you know, sort of to combat ageism. And I think we have come a long way because, you know, you see individuals in the media. We actually had one who ran the marathon at 93 years old. All of these things on wanting to live to, you know, well over 120 with these aspirations. And so, yes, there's still a lot of work to do, and there are those that are ageist, but I think social media has played a role in breaking some of these myths and stigmas.
That's very fascinating, thank you.
Yes.
So let's turn to health and caregiving. I'll start with Rosanne on this. What strategies or initiatives can be implemented to ensure that healthcare systems meet the unique needs of older adults?
So I would piggyback onto Lorraine when she was talking about age-friendly. There are age-friendly health systems that are being developed. And what they really do is look at 4 or 5 things that are called the 4 or 5 M's, depending on where you're sitting. And the first M is what matters most. And getting people, again, starting with what the people want, an individual wants, to say, this is what matters most to me. This is what my health care is in service of, okay? It's not so you can check your boxes, I keep saying. Obviously, I have a little thought about that. The second has to do with mind, okay? That we really all want to do everything we possibly can to keep our minds as sharp as possible. And then that brain health is heart health, and heart health is brain health. And so there are a lot of things that we can do to help ourselves as far as that goes. The third is medications. We have, to my way of looking at it, a very over-medicated society, and we are pushing like crazy in TV and ads and all over the place, taking lots of medications. And I feel like, you know, we need to be Goldilocks, okay? Not too much, not too little, just right for you, for what you need. And people and their doctors need to really look at that. Mobility, which was mentioned, okay? The ability to get around, to not fall, to not break that hip. And then the last one, which I think we all work with, is multi-complexity. It's not as simple. You know, when I talk to 30-year-olds, 40-year-olds that talk about doctor-patient relationships, they don't want a relationship, they want a prescription. Okay? That's what I'm told. But when you have all of these things going on, you need that quarterback. You need someone to help you weigh what's important and what's most important for you. So that would be my opinion.
So I think, you know, again, to add, in our world, a care navigator becomes, you know, essential. And I think quarterback is a good word. I think the health systems have already developed care navigators or partnered with organizations like CaringKind if one, you know, was experiencing short-term or long-term memory loss. And I think good communication between healthcare systems. As I was earlier, before coming to CaringKind, as I was running healthcare organizations, nursing homes, assisted living, daycares, the communication, even among its own entities, is so poor. And people don't actually have time to read what's written in the documents. They just don't have time, and there's no time built in to read. And so you're really just reacting all day long, putting out fires, and then you go back and you finally are doing your notes, and you realize like 3 of the interventions could have been maybe circumvented if you had read all the case notes. So I think it's just, again, this medical reform. I think we have to kind of go back to basics and look at some of the stuff that we're pushing out, because ultimately the patients are suffering and getting the short end of the stick.
I want to talk a little bit on caregiving in terms of the role of the informal caregiver. So we're talking about caregiving in its largest sense, but I would like to talk about the role of the caregiver. Each one of us is a caregiver at some point or other in our lives, and if you're a woman, you're usually a caregiver for your mother-in-law also. So that, and when aging services were started, there was a particular formula. You aged, then your family thought at one point that you would go into an institution. That has changed. And as the diversity of aging has changed, then that whole approach has changed. Because now different cultures have different views on aging and what the family role is. So the support for that informal caregiver is essential. So when I think about caregiving, I'm thinking about what structures do we have in place to support not only the care recipient, but also the caregiver. Because all of us who have taken that role, and I'm in that role now, I have a 94-year-old mother, and I'm 73, caring for a 94-year-old mother. And so that is, it's very taxing in its way. What are the supports, what's the information I need, and then how do I ensure that she gets the best care? That is something that we as a society need to start shifting, more from institutions, more to support for caregivers, and that means that the funding needs to be modeled after that. That's why I keep talking about age inclusive, because age inclusive talks about policy and legislation. Right now, most of the money is geared towards Medicaid, some of it for long-term managed care, but most of it for institutional care. And we need to have a major paradigm shift.
And there's no long-term care financing system in America, so particularly for the middle class, they're on their own, which is not very easy. Let's talk a little about cognitive health, and I'd like to ask you to start with this, Eleonora. In your experience, what are some effective ways to address the challenges of cognitive decline and to promote brain health in older adults? And what advice would you give to family members, care partners of older adults to provide better support and ensure that their loved ones have the dignity and independence they deserve?
So it really starts with your primary doctor, making sure that you have a primary physician who's educated about cognitive health. I'm so glad that you have all of these fellows that are being taught and you're teaching them. I know we participated trying to educate physicians. We recently relaunched a program called To Whom I May Concern, and it's a writer's workshop, and it's individuals with the disease. It's actually available on our website if you're ever interested in viewing it, but it is incredibly powerful. And these letters, it's To Whom I May Concern, some of these letters are actually written to their physicians on what it was like receiving the diagnosis. And the lack of, and actually one was a physician himself, the lack of empathy and real true understanding about what do I do beyond, I'll see you in 6 months, just to see how you're doing. There's really no quarterbacking happening. There is very little sending or receiving information in between. So families are often, they're often alone, and unfortunately on the internet, which is the last thing you want them to do. Surfing all of the worst things that can possibly happen. And so I think starting with the physician, and then also, if you're lucky enough and you can get in to see a neurologist, these ADRC units we're really blessed here in New York City to see a neurologist that is really tuned into all of these services. Until now, and again, it's in the news that there are so many more opportunities and options and treatments that are in our new future. But people still some qualify, some don't qualify financially. So it's not the same for everyone. the plan of care does not look the same, and it should look the same for everyone. And so I think it starts with your plan of care, your medical plan of care, and then getting linked up to cognitive stimulation therapy programs like what we offer to increase socialization and lessen that, sort of depressive scale, because you're grieving the loss of your career, your life, and you're looking at a very lonely room.
Can you explain what cognitive stimulation therapy is in about 30 seconds or less?
Yes. So it's an intervention. I call it OT for your brain. For those, it's actually, we have an occupational therapist in our office, and she's the one who brought it to us, developed in the UK, and we're now, we've received a grant, an ACL grant, a little over a year and a half ago at CaringKind, and it is free to the public. And again, if you're looped into doctors like this, you'll get connected to CaringKind and get registered. So there's 3 levels. Level 1 is a 6-week course, then meeting either virtually or on site, and then you go into maintenance, and I'm missing one, Suzanne. And so there are 3 different levels, and every single person, the retention rate is almost 80-90% people retain, which is really unheard of. Most people start a program, they drop out, not this one. And so our hope is, and again, hopefully we'll be able to do some more studies and eventually white papers on this, is pairing this with the different therapeutics that are going to be available, because I don't believe it's just a one-lane story here. I think it's going to be, I always say it's not and or, it's and. And this is one intervention that right now you can actually do something about keeping your brain stimulated, doing a little OT for your brain.
Thank you. I want to turn to retirement and money. I want to ask Lorraine to start on this one. Are there specific policies or reforms that you believe are necessary to enhance the financial security and retirement options for older adults? And what are you doing in your department on that?
One of the first things we did was just look at New York City's policies, right, employment policies. And one of the first approaches that we did was we worked with the city's Department of Administration. It's called DCAS. I'm not going to tell you what the acronym stands for because I don't remember. But it basically manages all of the HR operations for all of the city agencies. And we worked with them to say, all right, you have an incredible initiative for diversity and equity for women and discrimination. What are you doing in aging? So we told them, take a step back, and we want that to be a focus area. So the first thing is practice at home.
It's very unusual.
Right, and so that's one of the things that we've been doing is working within the city to look at what practices that we have that are ageist, what practices that we have that are barriers, and looking at that, and also making it a focus area, included in DEI, diversity, equity, and inclusion, making sure that that too is a primary focus of it. As a result of that, then we work with other municipalities to do the same. And the other thing that we've done, 2 things that I think are very unique. We created a program to ensure that older retirees from New York City service have the opportunity to come back and work within the city without any impact on their pension. And so you can work within a city agency, not in the type of job you did before, because if you were a teacher, you might not want to do that again, but there might be other places that you want to work. And so we call that, Michael, what is it that we call that now? Now it has a new name. STARS, right? And so, so we have retirees, we're trying to encourage the state to do the same thing. And so you can work for 35 hours and for a week, and then receive income without impacting your pension. The other thing that we've done is that we've started, because we have workforce programs for older adults, one of the things that we started, and I really encourage all of you to work with us on this, is we've come up with a guideline for employers on looking at what are places to create a good environment, workplaces, for their older workers, and what would it take to retain their older workers, and I'm giving them a lot of information as the benefits that they have. And it's interesting, so we have this guidebook that we created, and we've asked several organizations nationally to look at it and pressure test it for us. And so we have a whole host of employers that we are giving this to, and we hope that it becomes the practice, because the science says that businesses, we know that businesses and boards that are diversified are very profitable. We also know that workplaces are very creative and profitable if you have age diversity also. So we're really pushing that from a looking at this in a structural way, but also legislatively.
Great. So we only have time for one more question. I'm sorry about that. But speaking about age diversity, I want to make sure we get to intergenerational relationships. I just wrote a piece for Martha Washington yesterday about how senior centers are modernizing around the country. And I went to one, I talked to a lot of them. I was really blown away with how some of them are changing. And one of the things some of them are doing are bringing younger people in to be with older people to do all kinds of things. So my question here, and I'll start with Eleonora, is Eleonora, are there any specific programs or initiatives that you've seen that have been successful to foster intergenerational connections and opportunities for older adults to stay engaged with younger generations?
So we are planning one in the end of fiscal 24, which is really exciting, providing a tech. We're actually, I've utilized robotics in senior living during COVID. Robotics actually helped with keeping residents engaged with their families when they weren't able to visit. And so actually the robots have started working at our office. We've got one right now. The brain hasn't been connected, but it's going to be connected next Wednesday, I'm told. And so really utilizing, there's a girls' school in the Bronx that is going to be pairing with CaringKind and helping us connect this technology with our older adults. We're going to start with our early stage group, and then we're going to go out in the community. And so Temi is the name, and actually I have a Temi in my house and has been a permanent family member for a couple of years. So really being open to technology and robotics and what it can do to help. And I would just say, when we did the program, like to the main concern, there was a member who said to the audience, we need technology because we want to go beyond the sticky notes on how to continually stay engaged. And so I know it's sort of AI and technology sounds scary, but this is a perfect opportunity to have the intergenerational programs, because clearly my 15-year-old taught me how to use AI, and this is what they could do for our seniors.
Great. Rosanne, anything you'd like to add?
Okay, because I'm sure you have more programs already.
Yeah, we're really proud of the intergenerational work. We work right now with 10 housing developments, New York City Public Housing, where we have intergenerational programs aligned with our older adult center and some of the youth programs in those communities. The goal of our intergenerational approach is always about community building, sustainability. I don't want one-off projects where we teach each other a story or we teach each other a game. It is how is it that we together, as the two anchors of a community, work together to build that community. So all of our programs are around about building that. And then of course the one that we're also proud of is the one that I just told you about before, which was in the public schools. That's intergenerational. That is sustainable. Those are going to be our future employers, our future workers, and we want them to be age inclusive in their thinking. So thank you for the questions.
Thank you, and thank you so much for the panelists.